Hey guys, this is Dr. Stoker in Los Angeles with a beautiful case, 2-week post-op results, so pretty early on. This patient had silicone gel implants placed through areolar incisions 30 years ago. She came to my office with these very bad capsular contractures. We call those Baker grade 4 capsular contractures, where the breasts were hard and deformed, most likely badly ruptured implants. So obviously, she needed to have those old implants removed, and we performed what's called a total en bloc capsulectomy. What does that mean? Well, when you have a breast implant, the body forms a fibrous layer of scar tissue or collagen around it. It's true of any implant in the body, whether it be a pacemaker or a joint replacement. But when it's on surrounding a breast implant, because the implants are malleable, in some patients, for a reason we don't fully understand, that scar tissue around the implant can thicken and distort the shape of the implant. It can make it hard, and typically it squeezes it so you end up with a very artificial appearing shelf in that area. It can even start to ache or become uncomfortable for patients. So the treatment for that is to do an en bloc capsulectomy. So what that means is going on the inside and peeling away all that fibrous scar tissue on the inside, and doing that in a way where it stays surrounding the breast implant, so it all comes out in one big, nice, satisfying piece. And that's exactly what we did here. We then use a triple antibiotic solution and betadine to wash out the pocket. This type of surgery does require drains. She had a little one coming out each side under her armpit here. I can't even see the incision. It's only 2 weeks. And the reason that drain is necessary is because when you peel out that extensive capsule, there's a lot of oozing on the inside, and you really need to evacuate that fluid. You don't want the implant floating in a sea of fluid in there. You want it to be evacuated so it heals exactly as we planned. And that's what we did. We used 440 cc moderate profile smooth, cohesive silicone gel implants on her. I use the Sientra brand. And they worked great. She's got a beautiful body, and really, I'd say, ideally shaped breasts now, where they're nice and feminine, but not excessive. If you look at her from the side view, you can see she's got a beautiful natural slope here. There's a soft. What would you say, without showing her face? What would you say is the most exciting thing about your new breasts? Is it the feel?
Oh, the feel. They're so soft. Compared to what they were rock hard, and they're very, very soft.
I hear that a lot. You know, if for those of you out there who have old implants in, especially if they're firm like that, a lot of people just don't realize. It just kind of sneaks up on them over the years. They don't realize that a procedure like this can totally transform their bodies. I mean, they look gorgeous and dramatically improved, but the way they feel, I think, is probably even more satisfying for her. So this is a much more difficult and involved procedure than just a primary breast augmentation type of case, but it's really satisfying, and I'm super pleased with the outcome, even though it's just early, 2 weeks post-op.